What we can achieve now is just phenomenal. Implants are a very elegant treatment option to completely avoid adjacent teeth and deal with your one problem and give you a solution for that straight away. It's a very gentle, simple procedure. As a general rule, it's a very elegant way to restore a tooth or teeth and give a patient a solution that doesn't mean affecting other teeth around it. We can these days now deliver a tooth that looks very natural. We can make everything look as if it was meant to be there. And what we can achieve now is just phenomenal. We do a nice fact-finding mission of doing a very in-depth consultation. It doesn't take very long for the patient, but I need to know certain parameters, whether or not they can have an implant, whether or not it will be successful. And once we've crossed that bridge and it is a good thing for them and it is a solution for them, I then will routinely send for a 3D CT scan so I can look at the bone in a three-dimensional way to be able to put the implant in, guided by where I want the final position of the tooth to be. So we're looking at it from a prosthetic point of view. Where's the tooth going to be? That's where we then place the implant in good bone. A lot of people are nervous about just generally seeing the dentist. That's a big hurdle in itself. And there's always loads of rumors that go around any dental treatment really, but we will do everything we can to make sure that we explain everything, to make sure that we go through the right pathway to get a good result, calmly, with confidence. I always say, front teeth, great to smile with, look phenomenal, but back teeth help support and keep the front teeth there. Too many times I hear patients say when I fit that final crown, how easy that was, how they should have done it sooner, and life is just so much better with teeth.